Hi and welcome back. If you're new to the channel, my name is Vince. Thanks for stopping by. You are very welcome here indeed. So today's video was prompted by this comment from the seeker of sense. They asked me to look into possible supplements that could reduce the risk of prostate cancer. Please remember, this is not medical advice, but all the information in this video was sourced from the NIH National Cancer Institute. Prostate cancer is the most common form of non-cutaneous cancer affecting men in the United States and indeed worldwide. On the basis of data from 2017 to 2019, it's estimated that in the US, 12.6% of men will be diagnosed with prostate cancer at some time during their lifetime. And there are links in the description below to the studies that I used to put this presentation together. So the first compound on the list is calcium. Major sources of calcium in the US, and I'm guessing around the world, are food and dietary supplements. And studies on the association between calcium and prostate cancer have been limited to nutritional sources of calcium, such as dairy products. Some studies propose that a total higher calcium intake may be associated with an increased risk of advanced and metastatic prostate cancer compared to those with a lower intake of calcium. But the NIH states that additional research is needed to clarify the effects of calcium and/or dairy products on prostate cancer risk. Then we have green tea. Some research has shown that green tea may have a protective effect against various forms of cancer, including prostate cancer. Laboratory, preclinical and early phase clinical trials have identified EGCG as one of the most potent modulators thought to be relevant to prostate carcinogenesis. EGCG has been shown to act as an androgen antagonist, and it can suppress prostate cancer cell proliferation, suppress the production of PSA by prostate cancer cells, and demonstrate potent and selective cell death activity in cancer cell lines in vitro. Oral intake of EGCG was associated with a significant reduction in tumour size, reduced multiplicity, and reduced development of prostate cancer in studies with transgenic adenocarcinoma of the mouse prostate. In Asian countries where a higher per capita rate of consumption of green tea takes place, prostate cancer mortality is among the lowest in the world. And the risk of prostate cancer appears to be increased among Asian men who abandon their original dietary habits upon migrating to the United States or indeed any country that follows the standard American diet. Preclinical studies have shown that vitamin D may have effects on prostate cancer cells through various pathways. Numerous epidemiological studies have researched the relationship between vitamin D and prostate cancer. Some interventional studies have focused on calcitriol, the hormonally active form of vitamin D in prostate cancer patients. Now, although the best source of vitamin D is the sun, those who live in countries where the sun is not that regularly seen can up their vitamin D levels by taking a vitamin D3 supplement. Next on the list is vitamin E. Food sources of vitamin E include vegetable oil, nuts, and egg yolks. I would steer clear of the vegetable oils. Studies propose that TAP may have capabilities as a tumour suppressor in prostate cancer. The Selenium and Vitamin E Cancer Prevention Trial, known as SELECT, a large multi-centre clinical trial, was initiated by the NIH in 2001. And this was to examine the effects of selenium and/or vitamin E on the development of prostate cancer. In 2011, updated results from the SELECT study showed that men who took vitamin E alone had a 17% increase in prostate cancer risk when compared to the men who took a placebo. In 2014, an analysis of the SELECT results showed the men who had high selenium status at baseline and who were randomly assigned to receive selenium supplementation had an increased risk of high-grade prostate cancer. But vitamin E supplementation had no effect at all among the men who had high selenium status. Then we have lycopene. This inhibits androgen receptor expression in prostate cancer cells in vitro and, along with some of its metabolites, reduce prostate cancer cell proliferation and may also modulate cell cycle progression. Lycopene may also affect the insulin-like growth factor, IGF, intercellular pathway inside prostate cancer cells. Results from several in vitro and animal studies have indicated that lycopene may have a chemopreventative effect for cancers of the prostate, skin, breast, lung, and also the liver. However, human trials have been inconsistent with their findings. In clinical trials, utilizing lycopene in prostate cancer patients with various clinical presentations have, to date, unfortunately yielded inconsistent results. The FDA has accepted the determination by various companies that their lycopene-containing products meet the FDA's requirements for the designation of generally recognized as safe, also known as GRAS. In clinical trials involving prostate cancer patients, doses ranging from 10 to 120 milligrams per day have been well tolerated, with only occasional mild to moderate gastrointestinal toxicities. Pomegranate juice and extract, as well as some of their bioactive compounds, inhibit the proliferation of various prostate cancer cell lines in vitro and induce cell death in a dose-dependent manner. That's apoptosis. Studies in rodent models of prostate cancer have shown that ingestion of pomegranate juice can decrease the rate of development, growth, and also the spread of prostate cancer. However, the only fully reported clinical trial in men showed that on average, study participants who drank the juice had an increase in their PSA doubling time. And this was associated with improved survival, i.e. slower progression of the disease. No serious adverse effects have been reported in clinical trials with pomegranate juice administration, and that's at 8 ounces per day for up to 33 months. Then we have citrus pectin. This is found in the peel and the pulp of citrus fruit and can be modified by treatment with high pH and also temperature. Preclinical research hints that modified citrus pectin, known as MCP, may have effects on cancer growth and metastasis through multiple potential mechanisms. Then we have Zyflamend. This is a dietary supplement that contains supercritical fluid, CO2, and hydrochloric extracts from the following herbs combined and suspended in olive oil. These are rosemary, turmeric, ginger, holly basil, green tea, huzang, Chinese goldthread, barberry, oregano, and Baikal skullcap. The individual components of Zyflamend have anti-inflammatory and possibly anti-carcinogenic properties. In various preclinical studies, Zyflamend has been shown to suppress the expression of certain genes involved in the inflammatory response and also in cancer progression. In other preclinical studies, it's demonstrated single-agent anti-cancer activity, and it's improved cancer suppression when used with hormonal and chemotherapy agents. Results of a phase 1 study of Zyflamend suggest that use of this supplement is not associated with serious toxicity or any adverse side effects. Next is African cherry. Bark from this tree is used by African tribes to treat urinary symptoms and gastric pain. Since 1969, the bark extracts have been available as prescription drugs in Europe and have widely been used to treat benign prostatic hyperplasia. 2 compounds of the bark extracts are androgen receptor inhibitors, as indicated by both in vitro and also animal studies. This activity is produced by each of these compounds at concentrations that are significantly lower than clinically achieved concentrations of the anti-androgen flutamide. Well, I hope you found that interesting or informative, hopefully both. As I said before, this is not medical advice in any way, shape or form. And I've left a link in the description below to the website I use to get this information. And if there's anything that you think is worth pursuing, then please feel free to visit the website and get much more information. And if you have any concerns or you're worried about prostate cancer, I urge you to get a PSA test and then meet with a medical professional as quickly as possible to discuss the results.